Imagine booking, a quick 16-minute lunchtime beauty treatment at your local high street clinic.
Right. Sounds easy enough.
Yeah. But then you find out you're actually being injected with a Class 3 medical device.
Which is, I mean, we need context for that.
Exactly. For context, that is the exact same regulatory risk category as a pacemaker or a breast implant.
It's wild to think about.
It really is. So welcome to the deep dive. Today we're looking at this booming trend in cosmetic gynecology. It's known as labial puffing.
Right.
And if you or someone you know is sort of navigating the world of aesthetic treatments right now, we are going to reveal a massive, frankly, an alarming gap between what glossy clinic marketing promises you and what medical regulators are actually saying.
Because the contrast between the advertising and the actual anatomical reality is just stark.
Yeah.
And the central mission we have to tackle today, the question driving this entire deep dive, is highly specific.
Let's hear it.
Is a labial puff treatment actually an off-label use of dermal fillers?
That's the big question.
Right. And to answer that, we have to navigate a pretty complex web of clinical marketing materials from the UK, the US, and Dubai.
We've got quite the stack of sources today.
We do. And we need to cross-reference those with product specifications for the actual chemicals being injected, plus look really closely at the evolving guidelines from agencies like the MHRA and the FDA.
But I think before we get into the legalities of what's inside the syringe, we have to look at the anatomy first.
We have to know why people are doing this.
Exactly. So the medical term for a labial puff is labia majora augmentation.
Right.
And essentially it involves taking either hyaluronic acid fillers, or in some cases a patient's own transferred fat, and injecting it into the outer folds of the vulva.
Yeah.
And I think the immediate assumption a lot of people make is that this is purely cosmetic, like getting lip filler for your face.
Which is how it's often marketed, yeah.
Right. But looking at our clinical data, the motivation is often deeply functional. It's driven by something called genitourinary syndrome of menopause, or GSM.
Which is, well, the functional side of this is rarely discussed openly.
No, it's really not.
But as women age or go through childbirth or enter menopause, there is a significant systemic decline in estrogen.
Right.
And estrogen is crucial for maintaining the structural integrity of these tissues.
So when it drops...
When those hormone levels drop, collagen production slows way down, and the natural fat pads begin to diminish.
Wow.
The tissue literally deflates and thins out. It's a biological process called atrophy.
And that deflation cascades into a real mechanical problem. Because the labia majora aren't just there for aesthetics, right?
No, not at all.
They serve a biological protective function for the more delicate internal tissues of the vulva and the vaginal opening.
Exactly.
You can think of them almost like the internal shock absorbers in a pair of high-end running shoes.
That's a really good way to put it.
Right. Like when you first buy those shoes, you have all this natural padding protecting your foot from the harsh impact of the pavement.
Yeah.
But over years of use, that foam compresses. It wears away.
And suddenly you feel every bump.
Exactly. Suddenly every single step you take creates friction and rubbing and pain because you've lost your shock absorbers.
And when you lose those anatomical shock absorbers, everyday physical activity becomes a source of profound distress for a lot of women.
Right.
They experience chafing during exercise, particularly activities like cycling or running, and they can have significant pain during intercourse.
Look, it's awful.
It is. Now, the standard highly effective medical treatment for a GSM is vaginal estrogen therapy.
Okay, so a hormone cream.
Right. But hormone therapy has structural limits. It is excellent at improving the health of the mucosal tissue, bringing back moisture and elasticity to the surface layer.
Right, but what about the padding?
Exactly. What it cannot do is magically rebuild a fat pad that has already significantly diminished.
Which is the exact reason women are turning to injectables in the first place.
Yes.
They are seeking mechanical relief for a mechanical problem. They want to physically rebuild that protective cushioning that hormones alone simply cannot replace.
And we have two main ways to replace that volume. The first is autologous fat transfer.
So, using your own fat.
Right. This involves a surgeon performing minor liposuction to harvest fat from the patient's thighs or abdomen.
Okay.
Then they purify that fat in a centrifuge and carefully re-inject it into the labia.
That sounds pretty involved.
It is. Because it's a surgical procedure with a longer recovery time, a lot of patients and clinics opt for the second, much faster option.
Which is the filler.
Right. Hyaluronic acid dermal fillers.
Let's unpack how hyaluronic acid actually works, because it's not just like a simple putty that you shove in there.
No, it's very chemically active.
Right. Hyaluronic acid, or HA, is a naturally occurring molecule in the body that acts like a microscopic sponge.
Mm-hmm.
It binds to water molecules in the surrounding tissue. I mean, it can hold up to 1,000 times its own weight in water.
Which is incredible.
Yeah. So when you inject an AK gel under the skin, it immediately pulls in moisture to create localized volume and plumpness.
And that mechanism is highly effective for generating immediate volume.
Yeah.
Which brings us directly back to the core question of our deep dive. Is injecting this microscopic HA sponge into the labia an off-label use of dermal fillers?
The million-dollar question.
Right. And the answer is both yes and no.
Oh, of course it is.
Yeah, it depends entirely on the specific brand of syringe the practitioner decides to open.
Okay, well, let's look at the yes side first. If you walk into many clinics in the US or Dubai, their own marketing materials openly admit they're using standard hyaluronic acid dermal fillers for the labia.
Yes, they do.
We are talking about brands you'd easily recognize from facial aesthetics, like, Juvederm, Restylane, or Revenus Versa Placé.
Right.
Using those specific products down there is completely off-label.
And if you're wondering what off-label actually means in a clinical setting,
Please, explain that.
it means using a medical product in a way, or at a dosage, or in a part of the body that was not officially and rigorously tested and approved by regulators.
So like the FDA in America or the MHRA in the UK?
Exactly. Facial fillers were engineered and approved for smoothing forehead wrinkles, plumping lips, adding volume to cheekbones.
Things on your face.
Right. They were never designed to withstand the unique mechanical stress, the friction, and the specific anatomical environment of the vulva.
And the UK's Joint Council for Cosmetic Practitioners, the JCCP, is incredibly strict on this point.
Very much so.
They explicitly warn against taking a facial dermal filler and using it for body augmentation, which includes the genitals.
Yeah.
They state on the record that doing so carries an, quote, unknown and unacceptable risk profile.
Unacceptable risk. That's strong wording.
It really is. But you said there is a no side to our core question, so it isn't always off-label.
No, it's not, because a French company called Vivacy has engineered a product line called Deserial and Deserial Plus,
Okay.
which is a Class 3 medical device carrying a European CE mark specifically formulated and registered for the vulvovaginal area.
Wow, okay.
So that one is 100% on label.
And it's made exactly for this.
Right. And the engineering behind Deserial Plus is a great example of why specific anatomical design matters so much.
How is it different from the face stuff?
Well, it utilizes a cross-linked hyaluronic acid gel that is far more elastic than, say, a stiff cheek filler.
Okay, that makes sense.
A facial filler needs to be rigid to hold up a cheekbone against gravity. But if you put that stiff gel into a high-friction dynamic area like the labia, it doesn't flex naturally.
Right, you're constantly moving.
Exactly. Deserial is designed to yield to pressure. And furthermore, the manufacturer incorporates an antioxidant called mannitol right into the gel.
Okay, the mannitol thing is fascinating to me. It's a naturally occurring sugar alcohol, right? Found in things like celery and raspberries.
Yeah, exactly.
But what is a raspberry antioxidant doing in a syringe of filler?
Its function inside the filler is purely chemical protection. You see, whenever a needle pierces human tissue, it causes microtrauma.
Sure.
The body's immediate inflammatory response to that trauma generates free radicals, which are highly reactive molecules that quickly attack and degrade hyaluronic acid.
So the body is attacking the filler as soon as it goes in.
Right. But by including mannitol, the filler has a built-in free radical scavenger.
Oh, wow.
The mannitol neutralizes that inflammatory response. This significantly reduces the immediate post-injection swelling, and it slows down how fast the body breaks down the HA gel.
Making it last longer.
Exactly. It makes the structural relief last much longer.
Okay, wait. I'm stuck on something here.
What's that?
If an advanced, highly regulated, explicitly approved product like Deserial exists specifically for the vulva, it makes zero sense to me that clinics would risk huge liabilities to use off-label facial fillers instead.
You would think so.
Are practitioners just completely ignoring the medical guidelines?
It's basically a matter of medical liability intersecting with basic supply chain economics.
Okay, walk me through that.
Prescribing or using a product off-label is not actually illegal in medicine. Physicians do it frequently when clinical evidence supports it.
Sure, we see that a lot.
However, the moment a practitioner takes a facial filler and injects it into a patient's labia, the manufacturer's liability vanishes completely.
Poof, gone.
Right. If a complication occurs, the brand will accurately state, hey, we never instructed the product to be used there. So the practitioner absorbs all the legal and medical risk.
So why on earth take on that massive liability nightmare?
Because a bustling aesthetic clinic likely already has a commercial fridge packed with thousands of dollars worth of Juvederm or Restylane.
Oh, I see.
Yeah. Ordering a highly specific niche product like Deserial requires setting up new supplier accounts, managing separate inventory, and undergoing specialized training mandated by the manufacturer.
That's a lot of extra work.
It is. So for a practitioner prioritizing volume and profit margins, it is just far cheaper and more convenient to simply reach into the fridge and use the facial filler they already have in stock.
Wow. Okay, but if the manufacturers won't take liability and the doctors are taking a massive personal risk, who is actually policing this?
Well, that's the problem.
Because looking at the UK market alone, our sources say there are estimated to be over 160 different brands of dermal filler available. It seems like nobody's watching the gate at all.
And that staggering number of brands is the result of a bizarre, decades-old loophole in European and UK law.
A loophole.
Yeah. Historically, medical device regulations were heavily based on the manufacturer's intended purpose.
Okay.
If a company produced a syringe of hyaluronic acid gel and claimed it was purely for a cosmetic purpose, say, to smooth out a wrinkle so the user felt prettier,
Right.
and they made absolutely no claims about treating a medical condition, that gel often bypassed stringent medical device regulations entirely.
Wait, a substance that a person physically injects deep under someone else's skin was regulated more like a general consumer product, just because the box said it was for beauty.
Yes. The classification hinged entirely on the marketing claim, rather than the physical mechanism of action inside the human body.
That's insane.
It allowed a flood of low-cost, minimally tested filler brands to hit the market. But the regulatory landscape is currently undergoing a massive seismic shift.
Thank goodness.
The Medicines and Healthcare Products Regulatory Agency, the MHRA, is actively closing this loophole. They are bringing all dermal fillers, regardless of whether they claim a medical or a purely aesthetic purpose, under the strict scope of UK medical device regulations.
And they aren't just making the medical devices, right? They are classifying them as high-risk Class 3 devices.
Exactly.
To put a Class 3 risk into perspective for you listening, this is the most stringent regulatory category available. We are talking about life-sustaining or highly invasive technologies.
Like we said, a pacemaker is a Class 3 device.
Right, a breast implant is a Class 3 device.
Yes.
Under the lagging legal system we have right now, a product with the same regulatory risk profile as a pacemaker can be legally injected into someone's intimate areas by an individual with literally zero formal medical training.
Because the MHRA regulates the physical syringe of filler to ensure the gel inside isn't contaminated, they have no legal authority over the hands holding that syringe.
So the product is regulated, but the practitioner is not.
Right.
Which is a terrifying gap in the law.
Yeah.
So how is the government proposing to actually fix it?
Well, the Department of Health and Social Care is currently stepping in with proposals for a strict national licensing regime.
Okay, good.
Their consultation documents explicitly propose restricting any procedure aimed at augmenting the genitals exclusively to qualified, regulated healthcare professionals.
Makes sense.
And they also want to mandate that these procedures only take place in premises registered with the Care Quality Commission, or CQC.
Okay, so the CQC is the independent regulator that inspects hospitals and general practices in England.
Yes.
So this would effectively end the era of high street beauty salons performing intimate injections in a back room.
That is absolutely the goal. The JCCP, alongside the Chartered Institute of Environmental Health, has reviewed the clinical evidence and categorized genital augmentation, whether using dermal filler or fat transfer, as a surgical procedure.
A surgical procedure,
Yeah.
not a beauty tweak.
Exactly. They state unequivocally that these treatments should only be performed by GMC-registered medical doctors, specifically specialist plastic surgeons or gynecologists operating in those CQC-registered clinical environments.
This regulatory catch-up is just so critical because the disconnect between how these procedures are sold to women and the actual medical risks involved is staggering.
It really is night and day.
Let's look at the marketing language from the Dubai and UK clinic sources we have. They advertise the labial puff as a, quote, 16-minute procedure.
Yeah.
They call it a lunchtime treatment. It's consistently framed as this minimally invasive, virtually risk-free confidence booster that you can just squeeze in between going to the gym and picking up groceries.
And you have to contrast that breezy marketing with the official stances of major medical bodies.
Right.
The American College of Obstetricians and Gynecologists, or ACOG, and the US FDA take a very firm opposing view.
What do they say?
They consider cosmetic vaginal surgery, which includes off-label filler injections, as not medically indicated.
Period.
Period. They actively warn consumers against marketing claims that promise improved sexual pleasure, citing a severe lack of long-term peer-reviewed safety data.
And when you dig into the actual mechanics of what can go wrong, you quickly realize this is definitely not a lunchtime concern.
No, it's not.
The risks of off-label or poorly administered fillers in this area include severe bleeding, localized infection, and the filler migrating away from the injection site.
Which happens more than people think.
Yeah. And using stiff facial fillers can lead to the formation of hard, painful nodules under the delicate skin. But the most terrifying risk by far is vascular occlusion.
Yes. Vascular occlusion is a critical, time-sensitive medical emergency.
How does it happen?
Well, the pelvic region has an incredibly complex, rich arterial blood supply. When a practitioner injects a thick, cohesive gel blindly into this tissue, two things can happen.
Okay.
They might accidentally inject the gel directly inside a blood vessel, creating an immediate physical blockage.
Oh, God.
Or they might inject a large volume of gel so tightly around a vessel that the pressure compresses the artery from the outside.
So it just squeezes it shut.
In either scenario, the blood supply is completely choked off.
And when tissue is starved of oxygen, it begins to die, which is a process called necrosis.
Exactly. And the consequences of necrosis in the vulvar area are devastating. It requires complex reconstructive surgery to remove the dead tissue.
I can't even imagine.
But the systemic risks are even higher. The JCCP appendix cites a peer-reviewed case study detailing a death from a pulmonary embolism caused directly by a vaginal injection of hyaluronic acid.
Wait, a pulmonary embolism means the blockage traveled to the lungs.
Yes. In that specific case, the filler gel entered the venous circulation during the injection.
Oh, my God.
The gel traveled through the patient's bloodstream, returned to the right side of the heart, and was pumped directly into the pulmonary artery, permanently blocking the blood supply to the lungs.
That is just chilling.
It is an extreme, tragic example, but it highlights the absolute necessity of profound anatomical knowledge. A practitioner must know exactly where the internal pudendal artery and its branches are located to avoid them.
Right.
Furthermore, they must have the medical training to immediately recognize the subtle early signs of an occlusion and have emergency reversal agents like the enzyme hyaluronidase, which dissolves HA, ready to deploy within minutes.
You know, reading the glossy marketing brochures side by side with the mechanics of a pulmonary embolism, it's like buying a parachute based entirely on the color of the backpack.
That is exactly what it's like.
You're looking at the advertising thinking, oh, it's pink, it's lightweight, it takes 16 minutes to put on, while completely ignoring who packed the parachute, what the cords are made of, or if the mechanism will actually open when you jump out of the plane. The shiny advertising deliberately hides the life or death mechanics underneath.
And the JCCP actively advises practitioners to demonstrate professional constraint regarding this exact issue.
Yeah.
In their formal response to the General Medical Council's guidance, they warn doctors against letting commercial interests and aggressive marketing supersede basic ethical medical principles.
But until those laws fully change, the burden of safety falls heavily on the patient.
It really does. You must look past the advertising and ask hard, specific questions.
So wrapping up our mission today, is a labial puff an off-label use of dermal fillers?
Yeah.
If you sit in a clinic chair and your practitioner reaches for a standard facial filler meant for cheeks or lips, absolutely yes.
Yep.
It is an off-label use. The gel is structurally inappropriate for the mechanical friction of that anatomy, and it carries major, unpredictable risks.
However, specific on-label products like Diserial do exist. They're engineered with the correct elasticity and antioxidants for this exact anatomical purpose, and they carry a legitimate CE mark. But the broader takeaway is that the UK landscape is shifting rapidly to classify this not as a casual beauty treatment, but as a surgical procedure requiring CQC-registered medical oversight.
Which is huge.
It is. If you are considering this treatment, you are stepping into a heavily debated medical frontier. You must advocate for yourself.
Absolutely.
Demand to know the exact brand of the device being used, verify that it is explicitly on label, and ensure your practitioner is a highly qualified, regulated healthcare professional equipped to handle severe vascular emergencies.
Which leaves us with a final thought to mull over today.
Yeah, let's hear it.
The clinical data clearly shows that countless women are seeking this treatment to relieve genuine, debilitating physical pain. They are looking for a structural solution to the tissue loss caused by the natural processes of childbirth and menopause.
Right. Functional issues.
Exactly. But if these are standard, functional, biological issues of the female body, why on earth are the solutions being marketed as designer cosmetic tweaks in high-street beauty salons?
It's a great question.
As these new regulations finally tighten and close the loopholes, will these treatments be forced out of the unregulated beauty industry and rightly reclaimed by mainstream women's healthcare? Will the medical establishment finally treat the loss of our anatomical shock absorbers with the seriousness it deserves? Something to think about. Thanks for joining us on this deep dive. See you next time.